So people understand that discrimination exists. Whether you look at medical school intake, whether you look at examination pass rates, whether you look at postgraduate examination pass rates, whether you look at who gets merit awards, who gets the top jobs, why there's so few medical directors, people understand that there are differential issues around in these areas. And of course the point is that they're caused by racism.
So the inequalities that we see start much earlier, and those have to be addressed. And then when doctors come on, BAME doctors need those friendships, need those relationships. The employers need to create a safe space where people are supported the way that they come.
A really good way to support BME doctors and medical students is just by increasing representation. There is support available, but not many people know about that support. So I think collectively we all need to work to just push ourselves out there.
There's a large proportion of GPs and doctors in the UK who are from ethnic minority background. We owe it to our patients and to these doctors to make sure that all of these doctors have the same opportunity to express themselves and to reach their full potential.
Britain is becoming more increasingly diverse. You have people from different ethnic backgrounds, people from different classes, and they're accessing the NHS every single day. And I think it's important to have medical practitioners that are reflective, that can relate to some level, and also just the fact that they're adequate.
I really 100% believe that the way we can improve the experience of BAME doctors and students, maybe increase the number of BAME students entering medical school and improve satisfaction in the workplace, is via role modelling and mentorship.
It makes such a difference to have a little bit of advice for someone who's been there before, who may have experienced some of the challenges and difficulties that you've had, and can give you some advice or maybe suggest something that you may not have thought of.
Medical education needs to change. There's a lot that has been done, and for which I am so grateful for, but there is still more. Too often, I train medical students and junior doctors, and maybe even consultants, are put into situations where there is no support for them for their pastoral side.
It's really important that we have inclusive leadership, that mentorship moves from an optional extra, a kind of luxury item, to something that's mandatory, and the educational supervisors signpost trainees to mentoring relationships.
Having a mentor, especially a black mentor, will mean that prospective medical students will feel like they are represented and can see that it is possible for them to get into medicine and be a doctor, regardless of their skin colour.
Whatever we do it right for the patients. It is they who matter. It's our NHS, and we all need it. We all need safe and the best NHS.